I'm Jerry Allen. I'm running for the Oregon State Senate. We are in the greatest crisis that I've ever seen. I don't know if I don't know anybody who thinks that it's otherwise. This is a huge crisis. It has many dimensions. Certainly the pandemic of COVID-19 and the accompanying economic crisis that seems to be getting worse. In this time of crisis, we need caring, compassionate, cooperative legislators to work hand in hand with the administration here in Oregon in order to figure out how we're going to get through this and rebuild Oregon in a greener fashion and put people to work, put the jobs back in place, rebuilding the backbone of the economy, doing all of the things that have to be done to create jobs in a way that is compatible with where we need to go with the climate crisis and everything else. We also have to address the need for things like affordable housing, which is huge. Grants Pass ranks #3 in the United States in towns with least affordable housing. That's a pretty bad statistic. We have to work on protection from wildfires. We have to deepen our renewal of regenerative agriculture so that we can address climate and feeding our people here in this community, in these communities at the same time. And we have to keep building and strengthening our educational system. My background, I'm a small farmer and I'm a fire district volunteer and a library volunteer. But before I retired, I had a background as a hospital executive. I did a master's in public health. I was a clinic founder, an occupational medical clinic at Peralta Hospital in Oakland. I was elected to 4 terms as a financial trustee of a $2 billion pension fund that took care of all of the people, the governmental employees of Sonoma County. I have a lot of experience to bring to the job that can relate to some of these crises that we are facing. And this is my promise to you. I will not run away from the job. I will show up to work. I will really work hard to get Southern Oregon our fair share of assistance and rebuilding money. I won't waste public money. I will tell the truth, the whole truth, and nothing but the truth. And I'll be transparent in my work as your state senator. And I am determined to win this contest and to not have Art Robinson be in the Senate. He is not someone that we need who can help solve these problems. I am. So I'm asking for your support. And tonight we're doing this town hall on the crisis in healthcare. The crisis in healthcare has many dimensions to it, and we have several physicians here to help us in discussing this and making sense of it. We have the dimensions of affordability of care for people who are losing their jobs, the potential budget crisis of the Oregon Health Plan, when so many more thousands of people are needing to be provided with healthcare coverage. We have issues of trauma for children. We have issues of how to protect our caregivers so that they do not contract the virus in trying to help people. There are many, many different elements to this. So we have several physicians here with us tonight. We have Barbara Vallona, who is an internationally experienced emergency physician, MD, MPH, has a public health background as well. We have Ginger Jaschke, who is a pediatric psychiatrist and has a lot of experience in prevention and has been on task forces at the highest level of state government on prevention issues and mental health and children's issues. And we have Kathy Meckling, who is a family practice physician practicing here in the Illinois Valley in Selma. She is the only family practice physician in this whole valley. So she's kind of a lifeline in this region. So we have these 3 physicians with us, and I'm going to invite them to say a little bit about what they see as some of the concerns. But I do want to mention to anybody else who's listening or watching that you can use the chat button on your computer. It's on the bottom of the screen. On your phone, if you're doing it with your phone, it may be over to the side. But you can use the chat button to write a question. And then David Kipe, who is here running this Zoom meeting, he will see those chats and be able to prompt me to bring those up and bring that dialogue in with us. Did I leave anything out here, David? No.
I don't think so, other than just for everyone to be aware, we are recording this for posting on Jerry's website.
Right, thank you. Okay, so let's start here. Barbara Valona, would you like to speak first?
Sure. That gives me a much wider field than the others. I did not prepare anything because, as you know, I wasn't in town. But so I do hope that you have plenty of questions, because I think a question-driven conversation will be a lot more interesting anyhow. For me, some of, you had mentioned, I think in one of the emails, about physician burnout. And it got me thinking about, why is this so difficult for physicians, even in places where we're not seeing a lot of cases? I have not been inundated in any of the emergency departments I work in. There are studies on physician stress, and even in places where we're not seeing a lot of cases, it's very stressful for the docs. And I feel like that's quite expandable to, or extrapolatable to other healthcare providers. And I think what's not recognized by the general population, you look around and you think, well, nobody's really, we don't have a lot of death here. We're not being overwhelmed. But in the emergency department, it's all about, just like in other disaster situations, it's about preparation. And it's really hard when physicians have to do something brand new, because we're used to knowing everything. We're experts at everything we do on a day-to-day basis. And you have to add all the extra time and the donning and doffing. And I realized that I am responsible. Basically, if the nurses get COVID, it might be my fault, because I am the person who decides for the rest of the hospital whether this patient's in isolation or not. And you might say, well, just put them all in isolation. Well, except we can't do that. We physically can't do it. It probably leads to less effective healthcare, because there's no way healthcare workers are going to go in that room as often. And so when I have somebody who seems like they're just in a little heart failure, I don't want to put them in isolation. So there's all this decision making, and it's extremely stressful. I'm kind of used to it now that we've been doing it for a few months, but when this started, I think that was actually the most stressful thing, was having to make all these decisions and having the general population not realize or recognize that there was anything going on at all. No, you're muted, Jerry.
I muted myself. I remember about a month and a half ago, we had, I think, 6 cases in Josephine County, and some more than that in Jackson County. Now, as of today, we have 150 cases confirmed in Josephine County, and more than that in Jackson County. And so any thought that somehow this region is just immune to the virus, we got to get over that. That's not true. And so as the numbers rise and your incidence of hospitalizations rise, the things that you're talking about are going to get more stressful, because there's going to be more cases.
When I think it's going to get a lot more real for the people who so far have been buffered from seeing any of this, unfortunately.
Well, the hope that I would have, I know that a lot of us have, is that somehow the arrival of substantially more of the COVID-19 virus will help folks here to get with it, as far as wearing masks, doing careful social distancing, washing their hands, doing all the things that need to be done, which people seem to think, well, it's not going to happen here. It is happening here. So that's a big issue. You want to say more?
Oh, it just occurred to me as you were talking that in May, when we were still as locked down as we've been, which has never really been a lockdown, but still, we did a pretty good job in Oregon. We were predicted to lose 131 people by the end of this. And we're already well over that. So it really says something. And I think the statisticians were right, but that was presuming we would continue with the measures that we were already doing. And we haven't. We've opened up. And I think we're really going to see a consequence of opening schools up.
Yes. Kathy, would you like to add any thoughts to this dialogue?
And there's kind of two things I worry about. One of the preventable, changeable problems, something Barb mentioned before, I think she's recorded, was that how partisan this PPE is. We still have people in our school district that don't believe in the virus. And so we're sending kids back to elementary school. Some of the teachers are very worried, and some of the teachers just know it's God's will that they're not going to get it. And that's like one of those unsurmountable things. The other is the real, no matter what we do, we're going to have some major consequences of this pandemic. People are very appropriately avoiding doctors' offices because if they don't need to come in, they really shouldn't come in. But they've already, I think New England Journal reported there's already a 25% increase in colon and breast cancers. No, decreased incidence of colon and breast cancer because it's just not getting found. People are avoiding their mammograms and their doctors. And they have these cancers. There's just this big lag of things that are normal, things that should be detected early, and we're going to miss them. So there's going to be a morbidity that's just inherent to the pandemic. There's nothing that politics had anything to do with. So that's going to be something I'm bracing for in the next several months. It's going to kind of roll in. There's just a lot of little things that we should be worried about and people are focusing on the ridiculous stuff, whether or not we should be wearing a mask, and not worrying about probably the mental health crisis that's going to be the tidal wave that's going to hit us soon, and other healthcare, and the lack of people are losing their jobs, so they're lacking in insurance, and so people are not going to be able to come to see it. There's just a lot of other very complex things that this pandemic is exposing. Plus, the pandemic's exposing so much inequality and injustice in America that we've always tried to not look at, but we're being forced to look at it. It's a good lesson.
I want to welcome Senator. Are you there?
Yeah.
Yeah. I want to welcome to the dialogue tonight Senator Jeff Golden. He is the Oregon State Senator from the neighboring district from the Ashland Medford region. And he's agreed to join us tonight. So he will probably have some thoughts as well about some of these subjects. And we're talking right now about some of the dimensions of the COVID-19 crisis, the crisis in healthcare. And I wanted to add on to what Dr. Meckling just spoke about by saying that I've been reading some articles that have got me pretty concerned about the approaching flu season, and the fact that we are probably going to have layered on top of our COVID virus issue in the healthcare, we're going to have flu season. And then we also have, like Kathy was just talking about, people not going to the physicians as much. we have less vaccination for measles going on. We have less of many elements of our regular healthcare system that are sort of having to be pushed aside a bit as we deal with this current pandemic crisis. And that's going to make things darn complicated and really more dangerous for us as we move along.
Can I add to that the correlate of the increased risk and unidentified problems in the social services and mental health arenas that right now, with preschools closed, schools closed, churches not gathering as much, the number of adult eyes on children that typically would identify problems and children at risk and get them into services are not there. And that is at the same time that we've got the, due to COVID and unemployment and so forth, we've got increased drug use, increased relapse of drug addiction. We've got increased domestic violence, increased poverty, and all of those are, we know, lead to child abuse and neglect. And so at the same time that children are likely to be having greater problems, they are less likely, their problems are less likely to be identified and addressed.
Yeah. Thank you for that. More?
Well, I'll just also to pick up on Barbara's point about the stressors for the healthcare providers. I spoke with my friend Summer Wolcott today, who is a program director for On Track, the drug treatment program in Medford and Grants Pass, and she notes that that OHA already is canceling contracts for services. They're freezing rates for services, and even threatening to roll back rates for services. And all of that is going to stress the healthcare providers, the online workers who are working with people with all these difficulties. So another source of stress.
Right. I would like to invite Senator Golden into the conversation. If I might ask you a question, Senator.
Sure.
Which is that as we see so many people losing their jobs and losing, at least a fraction of them, or some of them are losing their access to health coverage, then they might be turning to the Oregon Health Plan. Can you make a comment about what we're likely to see in terms of the budgetary issues for that lifeline service of providing healthcare for people? Is that going to become a crisis in and of itself, as far as having to cut back or do things to try to keep the Oregon Health Plan going? Do you have any thoughts on that?
My thoughts are a little grim on that. You know, I would put that in the same bucket as the general dilemma of finding $3 to $4 billion in cuts in the 21-23 biennium, which is what the projection is. You know, we were in special session week before last, ostensibly cutting $1.2 billion for the rest of the biennium, but we made it easy on ourselves by going very deep in the Education Stability Fund to keep the K through 12 budget steady, which prevented raids elsewhere. You know, we have a $2 a pack cigarette tax on the ballot in November. That failure would put the Oregon Health Plan in serious jeopardy right there. We're really relying on that money. That's pre-COVID. Now, you know, you've got a lot of people, as you know, I think I take your question to be part of the economic casualty is people who will lose their job healthcare, their employer-based healthcare, and where are they going to go? So, generally what I have to say about that is we are in a very crowded boat with other states on all of this. The demand for Medicare service will far exceed resources over the next year unless the federal government steps up. So right now, they're at a bit of an impasse about the so-called HEROES Act. In that, at issue is about $500 billion in aids to the states generally. So that's, part of that would go probably to bolstering and reinforcing the health plan. Absent serious federal assistance over the coming year or two, we're going to have a huge setback in our path to universal health care and in especially access of economically disadvantaged people to health care. There's no easy path that I can see other than federal assistance. Now you've got tens of millions of people pressuring the federal government on this, and that will probably increase. And a change in the Senate could change everything very fast. But we're not going to be able to handle this on our own, I guess, is the short answer. I haven't heard a scenario where there's a pocket somewhere we can dig into that's not, that's separate from federal assistance to the states. Well, I will say one thing, although that we're working on that hasn't gotten much publicity yet, but it's a beer and wine tax. We are 50th in the country on our beer and wine taxes. And there's a proposal out there, and we haven't changed it since 1977. And there's a proposal out there that would tax a 12-ounce can of wine, of beer, a couple of proposals. One would tax a drink of wine or beer 25 cents. And so another 25 cents for a can of beer, about $1.25 for a bottle of wine. Another one would have two stages. Under a certain volume would be a nickel a drink and 25 cents over it. And that's to protect Oregon craft beers and Oregon wineries. And the higher proposal would generate about $700 million a biennium and would put us about 35th in the country for beer and wine taxes. We probably, if we try to do that, we probably would dedicate it to something related to alcohol and beer problems, and likely that would be the Oregon Health Plan. It would be a very heavy lift. It would take 2/3 votes, 60% vote, which is what we have to do to raise revenue. You have to be pretty optimistic right now to believe we could do it, but I do. I believe we could do it if we built an alliance around the state of enough human service providers whose programs are really getting gutted otherwise.
Thank you for that. One comment I want to make is that when I talk about taxes, I like to emphasize that, when I go to the hardware store, I don't just want to buy the cheapest tool. I buy the tool that's the best value for the dollar. I want to look at what I'm paying versus what is it going to accomplish. And I think we have to look at taxes that way. So when we're looking at the beer and wine tax or the cigarette tax, it's not just about raising taxes. It's about looking at what can we accomplish for the people by doing this. And that's why I'm a supporter and think that it's right for us to pass that cigarette tax, because it will go a long ways. It will really help us to do what we need for the people. And as far as your comment about the issue of having to get a 2/3 vote, that's why I want to get in the Senate, because I think that we really need more senators who are willing to step up to try to get done what Oregon needs to have done.
Well, before I give up the microphone, let me just reinforce that. I very, very much want to see Jerry elected to join us up there. as you know, we have 18 of 30 in the Democratic caucus right now. There are one or two of those that won't vote for really any revenue reform at all. And we really need 20, not just for revenue reform, but to keep the damn place going and prevent the walkouts that have been so damaging in the last couple of years. So I really, really hope you're able to gather folks in Josephine County and send Jerry to Salem. Badly need him.
Thank you, Senator, and thank you for showing up for this evening. We appreciate it.
Thank you. We'll be talking more, Jerry. Take care.
Okay, you too. So let's see. We're gonna go back here, and do we have some questions, David, that have shown up, or? Looks like there's something about hydroxychloroquine.
Sorry, there was a little thing on the safety of hydroxychloroquine. And it's awkward because if you ask me or Barbie what, I would say, well, what about the QT prolongation? And that is not a sentence I would expect anyone to understand who hasn't been to medical school, but QT prolongation can kill you, and hydroxychloroquine does it very well. It's not guaranteed to kill you, but I would never prescribe it unless I had someone's EKG and their cardiac history. So just danger. I think there is one of these little myths that it's safe. It is not a safe drug. Unless Barb wants to give it to somebody.
So I have taken not hydroxychloroquine, but chloroquine for malaria prevention. And but I also know I do not have a prolonged QT, and I needed it because malaria will kill me, and it is in the few areas left in the world where chloroquine can prevent malaria, it's absolutely necessary. But I can say all of the literature that I have seen is saying it's not worth that risk to treat COVID because there's no good evidence that it works. The early reports that it was working were very flawed studies, observational, small single center in China. Since then, there have been a couple of better studies, and I would love to see chloroquine work. If hydroxychloroquine could work, that would be amazing. I would prescribe it. I would do your EKG and then I'd prescribe it, but there's no evidence that it works. And so to do it just like, what do you have to lose? Well, your life. And it's the same reason I don't treat head colds with a Z-Pack, because you might have some bad reaction, even though we've all taken a Z-Pack, I imagine, even I have. And, so that's how I look at it, risk and benefit. And you gotta look at those ratios.
I've been following the public health research pretty closely, and I want to second what you said, that there are no major studies that have been published in the journals that say that hydroxychloroquine is effective for the treatment. There are some other studies going on things like there's an old from 1920s tuberculosis vaccine that is being tested, a large, well set up study in Australia and one set up in the Netherlands. And we don't know the results of those yet, but it has been used a lot for a side benefit of respiratory help to children in the third world. So we don't know. There's some of those things that rank as potentially hopeful, but certainly not the one that you've just been talking about. So let's see, where shall we go next with this? Do we have?
Can I just say a few things?
Go ahead.
Gunnar, with myself right here. I'm not very focused, but I have done a lot of study on hydrochloroquine, and a lot of the doctors outside of the country have used it very extensively. They use it very extensively in France until they put a lid on it, and so it's been highly politicized because it's it's used all over the world. It has been around for 65 years, and some of the clinical doctors, like one from Harvard, one report that I have here from Dr. Harvey Ree. She's an MD, PhD, and professor of epidemiology from Yale School of Public Health, and published in an affiliation with Johns Hopkins Bloomberg School of Public Health. So basically, the safety of HCQ is well established, that it should have been over the counter decades ago. And in fact, that it is how it is so much used in the world. The process to move a medication from prescription to over the counter in America is typically driven by pharmaceutical company that has a profit motive. Is a safe, well-established drug more profitable? So there is.
I'm going to have to.
There is extensive evidence of the use of hydrochloroquine, and the doctor himself said that if hydrochloroquine was used in the United States fluidly by the medical establishment, half the deaths could have been averted. And
I'm going to stop you there, because we don't have time in this meeting to have a long discussion about that. I know there's some strongly held feelings about it, but I want to get a chance to move on to some other topics, other dimensions of this healthcare crisis that I think we're going to need to focus on. And I'm going to ask if Dr. Jaski would be able to join in here and talk a little bit about some of the dimensions that you had brought up earlier that you wanted to talk about.
Yeah, and in fact, as a starting point, I'd refer back to what the senator who just spoke with us mentioned, that as far as he can see, there are no pools of money anywhere that are going to help solve this problem. But going back to prevention, there actually is a pool of money, and that is the resources that can be gained by preventing problems. So there's an economist at the University of Chicago, James Heckman, who is a Nobel laureate for his work showing that early intervention, and by early, he's talking from 0 to 3, really starting at birth or prenatally, to support child welfare, across the board, is the best application of the state dollar. You get your best return on the dollar by intervening in early childhood. So just take that, and then in Washington State, in the early 80s, Washington decided to set up a research, what's it called, Washington State Institute for Public Policy, and to carry out nonpartisan research to inform legislation. And they have a brilliant, again, economist up there, Steve Eos, who has developed a procedure for looking at the cost-benefit ratio of specific programs. So, for example, you can look at under the heading of juvenile justice, aggression replacement therapy, and what you get is a 42 return on the dollar. So for every dollar invested, you get a $42 return on that. Coordination of services, 13 to 1. And likewise, it shows programs that don't work, like Scared Straight. You lose $77 for every dollar you invest in that. But again, K through 12 education, teacher induction programs, 58 to 1 return on the dollar. So if you take even the least of those, the coordination of services at 13-to-1, $100,000 investment gets you $1,300,000 return on your investment. So, and if we don't make those investments, then we are incurring those expenses. We are incurring the cost of criminality, the cost of special education, the cost of high school dropout, and as Heckman in Chicago points out, that the human capital, the development of a child's brain and character, and you have to have both. So as far as character, it's impulse control, sustaining attention, all these elements that add to their cognitive abilities to create a productive citizen who's going to contribute to the welfare of the society and contribute taxes rather than being an expense to the country. So I see that as a pool of money. It's well demonstrated, it's well documented, and if we go toward prevention, we will have more resources in the future.
Great. I want to make a comment about that I remember many years ago in public health school that our professors were saying essentially the same thing. One of the things that they pointed out is that our whole healthcare system is terribly skewed toward the tertiary end of things, and we save lives in hospitals, and that's important, but we invest as a percentage of the 19% of gross domestic product that is spent on healthcare in the United States. We invest a very small percentage of that in prevention and public health, and we pay dearly for that. Our outcomes in the United States are much worse than most of the developed countries of the world, so-called developed countries of the world, and yet we're spending so much that we can't afford to spend any more to do what we need to do in order to spend less. It's kind of a loop that is not a very good one. So I wanted to make that comment. I also want to introduce Anne, who is here, and she has a background as a marriage and family child counselor. And so if you have a comment about anything here, Anne, feel free to join in or raise your hand, and I'll call on you. So in terms of what we can do, you had some ideas that you wanted to talk about, Ginger, about that, how we could try to make some shifts. We are all aware that there's a presidential election coming up, and if Joe Biden is elected, he says that they're going to do a lot of work to try to help out the states. That'd be great, but that's a long time off. January 20th is a long time from now. So what kinds of things, what kind of steps can we be taking to move forward as best we can now? And
So
to any of our panelists who want to talk about it. Go ahead, Ginger.
Well, I think first and foremost is the prevention. First and foremost is we need to apply scientific methodology to our decision making and do, for example, what Washington State has done, and you can look through charts that they have of which programs are efficacious and cost saving and which are not, and those then inform, for example, in just in the criminal justice policies that were adopted since 2000, that is calculated to save taxpayers and crime victims $2.77 billion by 2050, and not to mention 1,200 fewer persons in prison, and violent crime decreased by 20% between 2000 and 2011. So but you have to have the information base. And so number one is, I think that the Oregon has, the Oregon legislature has a research office, but I'm not sure, and I called today but didn't get a call back to find out whether they, are aware of the work that Washington State does on this, and whether we utilize that kind of study and information to guide our policy making. But I think that's number one, is we need to apply the scientific method and have the outcome studies.
Well, one of the great concerns that I have had lately is that the science, the front edge of it, they're learning all the time. CDC admits that. Dr. Fauci admits that. They're learning all the time. Well, one of the things they've realized is that asymptomatic people can spread the COVID-19 virus. So it isn't enough to just say, well, I don't feel sick, so I don't need to wear a mask. That doesn't cut it. So again, what you're saying about using the science to inform action and then asking the whole community to follow that requires leadership. It requires leadership on the part of the boards of commissioners of the counties and the public health departments, and the commissioners to back the public health departments. And then, if you have people who are saying, well, I'm just going to wait for the vaccine. Well, today it looks like there was a new report that someone was reinfected the second time after they had already resolved with the recovered from the COVID-19 virus. So there's a lot we still don't know, and that makes us have to fall back on the defensive position of masks, social distancing, contact tracing, quarantining, all of the things that have to be done. And any of you who want to make further comments about that, you're welcome to do so.
Yeah, this is interesting. I mean, I so appreciate that you're running, Jerry. I love, and that we do need to have science-based approaches to this. It's interesting that you're running against a guy who calls himself a scientist. A very dangerous man who believes what he wants to believe, but he's going to pull I'm a scientist and pull degrees that are and ludicrous, his ludicrous proposals. So I'm really glad that you're pulling real evidence-based consensus science.
Thank you. I might make one or two comments there that you raised him as an issue. Someone who has a history of opposing and wanting to abolish Social Security. He now says, well, it's okay, but that's not what he said in any of the times when he's run before. So I don't know if that's an election ploy or not. He also wants to abolish the public school system and go back entirely to homeschooling. And I ask parents when I talk to them, how's that worked out for you for the last 4 or 5 months? And everybody says, it's terrible. I'm not trained as a school teacher. And how am I supposed to go to work if I don't have public school? So that's just a couple of examples. He's also said that Caltech is a hard science university who demands a lot of rigor, and that's probably not for Black or people or women. And I have a quote of that. It's a direct quote that we're going to be publishing, who is Art Robinson, very shortly. So all of that will be out there. But I do think that the choice is stark. Do we want to send people to the legislature who can help deal with this crisis that we're in and listen to good science and try to do the right thing? Or do we want people who are going to be just an obstacle and just fight everything from a position that seems to be not based in real science? So anyway, I kind of got off on a tangent there.
I want to follow your tangent for a second, Jerry. I'm not reading this from the chat. I'm cheating and jumping in. But one of my real concerns is the mental health of our children. in the midst of all this, in the midst of the fear that so many of us are living with, that their parents are living with, in the midst of being so much more socially isolated. Michelle and I serve as respite foster parents, helping foster families with a place to bring their kids when they need it. And I'm wondering, for all the panelists, but particularly Ginger and Anne, if you have a comment on that, what can we do to care for the kids who are, really in need of socialization, social contact? This is a time in their lives where they are building their social skills, and so many of them are isolated at home, and for good reason need to be, for safety reasons, moving forward until we really have the pandemic more under control.
I wish I had a good answer to that. We're just beginning to think of ways to support them. There is on the ACAP, American Academy of Child and Adolescent Psychiatry, there is a document that helps parents explain COVID to children. And I can forward that link to Jerry to put it on your website. But it has information and graphics to help parents explain it. But I was just thinking while you were saying that in my patient sample, I have so many children with social phobia, and I'm smiling because they're loving this. And so it's a little irony that they're like, hey, my anxieties will way down. I don't have to go to school. I don't have to face other kids. This is great. So, but that's obviously a skewed sample, but in most children, well, in fact, even those children do need the social contact. They'd just rather not have it. But I think another thing is forming the pods, so families collecting together to have small groups that allow their children to be interactive with a small number of other children on a regular basis, and that decrease the risk of being in a classroom, and yet gives them some social contact and playtime and so forth. So those are a couple of ideas.
I want to throw in a comment here that the old study that was done through Kaiser, the Adverse Childhood Experiences study, which was such a great study that talks about basically the traumatic experiences that children have and how it impacts the rest of their life, is pretty dramatic if you look at the research examples. And one of the things that I got out of that is in terms of how we work with children when they are experiencing a new shock, whether it's an earthquake or a bad fire in the region or a pandemic that all of a sudden changes everything. Children are shaken and rattled by those kind of things. Any child is to some degree, but children who have a high score of having had a lot of adverse childhood experiences have an even harder time. And so we need to really look at that in each community and try to understand, what do we need to do? How do we help parents, like you were saying, how do we help parents to explain something to their child at the age appropriate level so the child can find some way to be with that isn't just sort of knocking them off their feet, so to speak. And any of you may have more to say about that, but that's certainly one of the areas of secondary prevention that I'm quite concerned about.
I might add just a little something. Can y'all hear me?
Yes, go ahead, Anne.
I think a lot of times kids look at their parents to see how they're dealing with things. And so for the segment of our population who's dealing with the fact that this is not a hoax, which is also a stress response, in my opinion. Finding a way for self-care for the parents, I think, is a really good first step, because clearly one of the things the kids benefit from in their development is mirroring. And if what you're demonstrating to your kids is fear, you can never go outside, or the world is ending and the sky is falling, and you know, just projecting out a lot of fear, which we all have. I just think it's really important for there to be an emphasis on self-care skills. And I haven't heard a lot about that, you know, on the tube, you know, about how important it is to provide good self-care for parents so that they can then provide good care for their children who are confused. Children are highly adaptable if given support, which kind of ties in with what you were saying, Jerry, about, you know, kids with adverse childhood experiences. They don't have the same level of healthy adaptability necessarily, nor do they have necessarily strong parent figures in their lives who can help them cope. So it's sort of idealistic of me, and probably naive, to feel like that should be on the top 10 of lists about things that folks can do without, you know, if they're not waiting for a magical cure or calling it a hoax, that's extremely important. Also, I think just in general, I don't know if you'll like this example, but like, you know, the Democratic National Convention, I watched all 4 nights. I think it was healing for a lot of people because there wasn't a lot of denial. And it was like, okay, we're going to face each of these issues. Now, granted, there are a lot of people who feel like they weren't faced in the perfect way, but at least they were bringing it up, saying these are really important issues and we're going to deal with them. And I feel like people felt like, oh, sanity. Wow, that's unusual. So I think that is sort of an example of how facing reality and dealing with it in a healthy way can be really healthy, not just for our kids, but for all of us. That's enough for me. Thanks.
Thank you, Ann. And I want to make a follow-up comment, which is I'm a big fan of support groups. In mental health field, I've advocated them for a long time. I've led support groups for many, many years. And it's a very economically efficient way to provide mental health support. But I think that in some way, we need to broaden that out to have support groups for parents, support groups for physicians who are on the front lines, support groups for nurses, for respiratory therapists, for any, I've done staff support groups in the past where we had multiple different types of professions in the same room together, but many of the same issues were being dealt with. And I think that if we do more support groups in many of our different settings, we have a chance of at least helping people to cope with what they're experiencing, so that the word for it is vicarious trauma, the trauma that happens to caregivers when they're around all these people who are having so many different troubles. Well, we want to reduce the load of that, and support groups is a good way to do it. And I'm curious if any of our physicians who are present tonight have seen any support groups happening among caregivers, or not so much. I wonder if you've seen that in either in hospital or clinic settings or anywhere.
I have not seen. Most hospitals will have a physician wellness committee or group, but I haven't seen anything about COVID. I have not been invited to anything like that. However, Indivisible has an activist support group, and you know, being an activist is exhausting, especially when you're a little blue dot in a red sea. And sitting around and talking about that has been really helpful. Yeah. So I agree, support groups are great. They don't have to be, for me, I don't even think it has to be, because I talk to healthcare workers all the time. We debrief constantly. But it's nice to be able to share that with other people and to talk about other things, because there's so many stressful things going on right now. It's not just COVID.
There is good research to show that support groups are helpful and prevent burnout and help people deal with vicarious trauma or frontline issues. And hearing what Anne was saying too about the importance of self-care and self-care skills and anxiety management skills, and putting that together with the group support, and that recently a friend who lost her husband mentioned to me that she's finding great support in a Zoom grief group, that she just picked up the flyer at the morgue and subsequently joined that, and she said it's extremely beneficial for her, life-saving really. And so we could have that. We could have online support groups for both healthcare workers, for citizens, and even a hotline or a warm line for questions about COVID management and so forth, to answer people's questions. I think there are a lot of online things we could potentially do.
Yeah, you just reminded me, Ginger. Actually, I have to step back a little bit of something that I said. The American College of Emergency Physicians does have a lot of wellness resources online, and they do have, there are free counseling sessions, there are peer-to-peer conversations that you can do. Emergency physicians are particularly prone to suicide, and so the college is really paying attention to that. So I haven't seen it at individual hospitals, but there is definitely the online availability.
I think therapists could benefit from support groups too.
So do we have, let's see if we have more questions here. Well, I really believe, I helped do some support groups in Grants Pass that we did through Sustainable Rogue Valley organization. It was a support groups for Earth activists, and we did that a few different times, and I can't remember how many times we did that, but I think it was maybe 3 or 4 times. So we may have to just keep working on those kind of things, finding settings. One of the things I've become convinced about is that you don't have to have a therapist to do a support group. I believe that people can get together and establish the boundary of confidentiality and establish a boundary of keep being kind to each other and hold a support group in whatever setting you're in. And many of the issues that we all are facing are multi-level. It might be directly about the impacts at our work, or it might be the financial stressors, or it might be the loneliness. I've talked to a lot of people who just feel very lonely because they're cooped up at home and they don't get to talk to very many people. There's many elders who are really kind of suffering, not kind of, they are suffering because they don't have outlets to talk with people. So, we can each pick up the phone and call somebody that we know and ask them how they're doing. And we can do our little support groups one-on-one right there on the phone because we all are in this together. And, I saw a quote recently that I really liked that said, "Change moves at the speed of trust." I like that. It's it just feels really true to me. And how are we going to get through this? How we're going to do that is somehow building bridges across our divides. We're going to build bridges across the divide of partisanship, of age, of skin color, of religion, of socioeconomic status, rural versus urban. We have plenty of areas of difference, but perhaps what we have in common is greater than what divides us. And I'd like to believe that. And I think that we can establish support groups across any divide. That it doesn't matter. We all are human, and we can be kind to each other and listen and provide support just by being a good listener. So anyway, that's a soapbox piece there.
I have a question, Jerry.
Go ahead.
Legislatively, how do you see yourself making an impact when you're elected in this area?
Oh, that's a good question. So
Thank you.
when I'm elected, as a new senator, I would not get my choice of committees, but I certainly would like to be on an environmental committee. I'd also like to be on a revenue committee, because I really believe that we've got to find ways to protect the services that are essential. So I would be working on at the committee level. And one of the things that I really believe works is legislators shouldn't try to be off to themselves making decisions. We need to have robust committee hearings where we bring folks in, invite people from diverse settings, from the different groups that are stakeholders on whatever issue we're working on. And that means if we're talking about healthcare, we're inviting in people who have, the professionals who have experience in those fields, because we need to inform the work. And I want to work on that really hard, informing the work. If we're talking about how do we reform police services, we need to be bringing in people of color. We need to be bringing in BIPOC people. We need to be bringing in people who know a lot about restorative justice. I'm just using that one as an example. If we bring in a lot of diverse voices who can work together, we can come up with plans for how we're going to solve problems. If we can work on prevention by bringing in people who have expertise and knowledge, we can talk about how can we do what we need to get done for the least cost possible, so that we can stretch our budget to get things done. So I think that is one element. Another element is that I believe that each senator and each representative has to be a spokesperson for what's right. That means I want to be charitable, I want to be kind, but I'm also going to call out wrongdoing. And I'm going to stand up for what needs to happen. And that means I need to not be shy about saying, whatever is the issue that we're working on, this is not right. And I'm going to hold a press conference and call it out. So I think that we have to stand strong and at the same time be cooperative. Does that make sense, what I'm saying? Okay.
So Jerry, can you lock the door and prevent the Republicans from leaving in the face of a vote?
Well, no.
Will you do that?
Yeah. The governor tried to do that and sent out the state troopers to try to catch them.
Yeah.
But, I will say I really don't understand it. And I know that Democrats have done that in the past. And I think it's just repugnant to me to see anybody of any party do that. Because when I stand up and take an oath of office that says, I am loyal to the Constitution of the state of Oregon and the whole democratic process, that's what I'm signing on to. I take an oath seriously, because I've made a pledge to tell the truth. So how can someone take an oath and then just abrogate it and run over the state line and avoid democracy? I don't understand it. But what Senator Golden said is true, that if we get 2 more senators, 2 more seats, in the Democratic Party in the Senate, that won't work anymore. We will have a supermajority in the Senate, and that will stop it cold. So, I mean, they could go out of state if they want, but we'll still carry on the business of the state because it will have a quorum. So that's one of the answers. I think the other answer is, change moves at the speed of trust. We've got to somehow try to reach beyond the divides. And sometimes on certain days, it seems impossible to me. When I read about some of the things that Jo Ray Perkins says, who's running for the United States Senate against Senator Jeff Merkley. She's a QAnon advocate, and they believe that the federal government is run by a bunch of pedophiles and they're going to put them all in Guantanamo Bay or what, I don't know. This is the conspiracy theory folks have infected the Republican Party, but it doesn't mean everybody. So I believe we can find reasonable people in any party who will say, okay, let's work together. And I'm going to give you one example and then I'll stop and give others room to speak. In my discussions in the Grange, I'm a member of the Grange, and I was in California. I was on the executive board of the Grange at the state level and long time in the Grange. Many, many Republicans in the Grange. And when I talk to them about the local economy, I talk about if we can relocalize our economy by getting people to shop locally and invest locally. Invest your money in credit unions or locally owned banks. Shop in stores that are locally owned. Do some research so that you can do that. The research shows that the money travels 7 times in the local community, cycling around before it leaves. Whereas if you buy in a big box store that's owned by Wall Street, so to speak, the money goes and it never comes back. And less than 1% of the money is ever reinvested in the local community. So when I bring that up and I talk about, we got to vote. I wrote a song about it. We got to vote every day, where we shop and where we save. For you and me, every day is election day. I was surprised that won unanimously as a resolution in the California State Grange. When I sang that song and I said, we got to pass a resolution that we do that, everybody voted for it. All the Republicans voted for it. And I realized at that moment, there are things that we can do that transcend partisanship. And we need to be finding those things. Fire is another one. We need to figure out how to work on fire together, because none of us want to see that toxic smoke or our houses burned up. So that's a complicated issue, but we've got to keep finding areas where we can build trust. I'm convinced we have to do that. It's a long answer to your question. So anybody else want to bring up another facet of what we're dealing with here, or have some other comments? You're welcome to do so. Barb?
I just wanted to piggyback on something that that Kathy had said when she first spoke, and about people not going to the doctor's office. The same thing is happening in the emergency departments, is that people are afraid to come in, and unfortunately, anything that stops people from coming to the emergency department, whether we say, okay, you got to pay $5, or you have to go through a gatekeeper, like your insurance company, or apparently a pandemic, it stops people who have nothing or just have a little sore throat and they just want some reassurance. It also stops people who are having heart attacks from coming in. And so one of the things to look at, if you like to look at the internet for statistics and an understanding, is looking at all-cause mortality rather than mortality from COVID-19, if you want to have a good understanding about where the pandemic is, because I think we're going to see right now, we had a really sharp spike, and then it's kind of looks like maybe it's evening, coming down a little bit. You can never really tell the last 3 weeks. You have to ignore the last 3 weeks of data. But if you look past that, It looks like maybe it's coming down. It's going to come up again when schools open. There's no way to avoid that. Some of that will go up. And if you look at all-cause mortality, I think it's a lot more telling, because there are people dying of things that aren't COVID, but it's happening because of COVID, if that makes sense. So they're dying more of heart attacks. We're going to see that cancer spike. I won't, hopefully, in the emergency, but you know, I see strokes come in way too late for treatment and that kind of thing. So as a public health thing, I think it's really good to recognize that if you need to be seen, you need to be seen. And the emergency department and your doctor's office will do what they need to keep you safe as possible.
I want to tag on to that, you know, there are plenty of things out there. For instance, breast cancer is a very, very serious piece of disease in the United States, huge. And we know that mammograms can help. Well, if people don't get mammograms because they're not going into the hospital or the clinic to get that done, then we're gonna miss something that is going to become life-threatening if we don't catch it quick enough. And that's just one example. There's plenty of others. We have people who are merging into moving into greater levels of diabetes than they were before. If that's not caught, that's gonna have a real health implication. So we have a lot of the pieces of what you're talking about. We're going to see, for instance, from the COVID-19 virus, we see it has organ effects that are apparently longer lasting than just the resolution of the immediate incidence of the virus for that person. So that emphasizes how important it's going to be to have follow-up care for all the people out there who are not at immediate risk of COVID-19, but they've got something that's got to get looked at.
Yeah.
I believe that we have another professional who's joined our conversation. Margaret, are you there? If you could unmute yourself, you could speak. I think maybe you're on the phone.
Hi, I just have slow internet out here at the end of Takilma Road, so I like to keep it simple. But I've been listening in, and I love the conversation. Thank you, everyone.
Would you tell us what your specialty is?
So I'm a naturopathic doctor, and so I am a primary care doctor in Oregon, and I also try to focus on natural medicine and healthy lifestyle strategies as the foundation, and then go up to higher force things like pharmaceuticals and whatnot as needed.
Great.
And counseling and support groups and things like that are also something that I have training in and facilitate for my patients also.
That's great. And the town that you're in, I knew where you were. Takilma is relatively remote. I mean, Cave Junction itself is a pretty small town, but then Takilma is 7 miles outside of Cave Junction. So it's important that we have your services there in that community.
Thanks. Yes.
Now I see your face. Okay.
The internet's cooperating tonight. So yes, I mean, I'm happy to participate. I love this conversation. I'm really excited about us all getting together and talking tonight. I love what everyone's saying. If there's anything I can do to help, let me know, definitely.
Well, I think we will continue these conversations in various forms, and I certainly want to continue to support what we call the mega support group, the support group of all of the people who are trying to make a difference and figuring out how we can support each other. It does sometimes feel like we're in a sea of Trump land here in the Illinois Valley, and not that the people are bad people. It's just that there's a lot of differences, and we have a lot of people here who aren't willing to follow the the guidelines. I was in a sandwich shop in Kirby a few weeks back with my son, and we had just had to take a load to the dump, and then we stopped to get a sandwich, and we're standing in line, and these people come in behind us who are not wearing masks, and I asked them if they'd please put their mask on, and they said no. And so I turned around to face the counter where I was ordering, and the young man came up behind me and coughed on the back of my neck and said, "I hope you get sick." And I just thought, you know, how has it come to this, that we lose our civility and treat each other in these ways? So anyway, I don't want to get off into that too much, but I think that it's really important that we continue to emphasize kindness, compassion, understanding, and try to do the best we can for each other.
It's good to know that we're all on the same page. It seems like this is the most excellent contrast to the Republican National Convention I could possibly imagine. So you had really great timing tonight. Thank you so much.
Thank you. Thanks for being here. And
Thank you.
we're coming just about to the close. We had said 6 to 7:30. It's getting close to 7:30. So I don't know if anyone has any last comments or questions. I'm certainly willing to, to have that happen. If you have more that Anne, you have some thought there?
I don't know if this is applicable here or not. It's just on my mind. It feels like, even with the divisions, that we're all grieving. It seems like that's important to feel, to take in, to recognize, to talk about. And again, I think the DNC was helpful in recognizing that grief. And it was healing. And yet it certainly isn't enough. I mean, everybody's going to forget the DNC in about a couple of days and be moving on from that experience. There'll be other experiences. So I just wanted to say that, because I think grieving is not a dirty word, something we all do, and it is a healing process. Okay, enough from me again.
I'm going to close by making a last pitch here, which is that I need people to write letters to the editor of the newspapers. You can write one letter a month. So we have the end of August, and then we have September, and then we have October. So if anyone is willing to write a letter to the editor talking about what your concerns are and saying that you support me and urging people to vote for me, that would be really great. I think that some people do read the newspaper still, and it impacts a segment of the population, and I would really love to have that. And if you have a few friends who are willing to write letters to the editor, I think it would be really great. Another thing that we have an opportunity for right now is phone banking. So if anybody would like to phone non-aligned voters, we have a whole thing set up to do that. These are people who have a score of the middle to left. So they're probably not Republicans. And we're trying to call them. We have their phone numbers. If you'd like to work on that, let us know. You can email me, JAllen at JerryAllenforSenate.com, or communications@JerryAllenforSenate.com. That's Jerry Ventura's email on the campaign. She's in charge of that. So there's those things that are available to do if you want to help move this forward. If you'd like to host a house party, let me know. We can do a Zoom house party where we work on things with your friends and neighbors. We'll be continuing to do these virtual town hall meetings. I have in mind to do one pretty soon, whether it's next Monday or the following one, on toxics and some of the issues that we face in our communities. We have a lot of toxic spraying that has been going on. We had an ordinance that passed, and then it was shoved aside to stop the spraying along roadsides, and so and also spraying of forests. So we're probably going to do something on that. We'll find some more subjects to talk about. I want to appreciate every one of you and our panelists, Dr. Bologna, Dr. Meckling, and Dr. Jaski, and Dr. Pilhauer. I probably misspelled your name or mispronounced your name. And all of you who've shown up tonight, thank you for your time. Be safe out there, and we'll see you again soon. Take care.